Hello and welcome to part 2 of our video on how your language is graded during the speaking subtest of the OET. Now this is part 2, and in this video we're going to be assigning grades to a student whose speaking task we heard in the first part of this video. So if you haven't watched part 1, I strongly recommend you watch that video first. I will put a link in the description so that you can check it out. If you have already watched part 1, then hopefully you have some ideas as to what grade, what band you think our student deserves for each of the language criteria of the speaking test. So let's have a look, and I will tell you what grades I think she would achieve, and we can see if your ideas match up with that. So when it comes to intelligibility, I thought that Kasia did a very good job. She was very easy to understand, and she was able to use those prosodic features such as intonation and sentence stress effectively to kind of guide the conversation and to help her to express herself. She had an appropriate tone of voice throughout. She was able to indicate that she was asking questions by raising her intonation at the end of the question. And generally there really wasn't much that was difficult to understand. There were a couple of words, and I mean literally one or two, which were mispronounced. For example, Mediterranean instead of Mediterranean. However, in the context, these didn't cause any difficulties with understanding her. So I would say a band 6/band 5. For the purposes of this video, we're going to be very harsh with our marking, and we're going to say a band 5. However, you could certainly make an argument for actually the top band 6 there, if you were prepared to overlook a couple of very minor errors. Fluency, there was a lot of hesitation. However, I think the vast majority of this hesitation was searching for content rather than because she lacked the language resources to express herself. However, the sheer amount of hesitation means that I think really we have to give it a 5 rather than a 6, but still nonetheless a good performance. Appropriateness of language, again, the vast majority of what she said was absolutely appropriate. She did a good job of explaining technical terms in everyday language. She maintained largely the appropriate formality that's expected between a doctor and a patient. The only area in which I would mark her down is that she did repeat the word like quite a lot as an interjection between phrases or between words, and this is something that's considered a marker of quite informal speech. Especially with young people, and it's considered quite slangy, I suppose, to say like the word like when you're giving examples like. So for that I would again be a bit harsh and mark her down to a band 5. Once again, it was nonetheless a very strong performance. And when it comes to resources of grammar and expression, here I think she did manage to achieve that top band 6. She did not have any trouble employing very idiomatic, native-like language, collocations, grammar structures effectively. She clearly is very comfortable using these grammar structures and these constructions, and yes, overall she came across as someone who has a very good command of English grammar and expression. So I think the phrases confident use of idiomatic speech, rich and flexible, both very much apply to her performance in this exam. So overall then, we're going to go for 5, 5, 5 and then 6 for grammar and expression, although in a lot of those areas she was also very close to achieving that top band, but was perhaps just let down by a couple of aspects, which I'm sure in the next mock exam task she will be quite easily able to fix, to rectify. So well done, Kasia, very good performance there. If you think she should have got a different band for any of these criteria, or if you have any queries or something you'd like to add, please do feel free to write it in the comments. That's all for now, and we'll be releasing a video next week dealing with the clinical criteria of the speaking subtest. So stay tuned for that. Okay, bye for now.
Did you know the AME now offers a writing feedback service to help you prepare for the OET? Head to academyofmedicalenglish.com to find out more.